In the Lancet's 200th year, we are drawing attention to the most critical issues impacting health globally: climate change, mental health, research for health, and universal health coverage. But across these domains, there's a huge population that is all too often neglected.
Ideally, we always want children and young people to live happy lives and focus on their studies and sport, these things. But because of this lack of action from adults that we have had in these past decades, like that, being able to reach solutions for conflict, for climate change, for these huge events that are happening right now around the world, it has led to young people to say, okay, we have to take action because otherwise this is the world that we're going to inherit. And whether or not we like it, we have to do something about this.
A quarter of deaths in children under 5 are attributable to environmental factors, such as toxic air, unsafe water, and inadequate sanitation.
I look out the window, especially during the winter months here in northern India. The only thing I can see are grey skies. And that's just kind of the color of the future that we can expect. Air pollution is impacting the entire physical and mental well-being of an adolescent today. When the air quality worsens, schools have to be shut down because of heat waves and extreme weather events. There have been major disruption caused to the education of adolescents. Students are given advisories from schools to stay at home, not engage in physical activity, etc. So all across the year, whether it's heat waves, air quality, or the pandemics we can expect in the future, education is being disrupted by the climate crisis. The opportunities that adolescents have today or in the future are all being dictated by these forces that are considered invisible but are already changing the way in which we get to live our lives as young people. There's a lot of eco-anxiety, climate anxiety amongst young people about the future that we're going to live in.
We need to be providing opportunities for young people to really shape the future worlds that they want to be living in. But in terms of their current world, we as adults can't abrogate that responsibility to others. That's our responsibility as adult society, to be functioning in ways that are much more protective. And so I think that thinking about the environmental determinants of health, the importance of planetary health, but also the commercial determinants of health, I think often when we think of youth participation and youth engagement, we talk about helping young people to find their voice. Well, most young people that I work with have got their voice pretty powerfully there.
Working with young people can lead to big changes in the world. We need to unite together to find solutions for their problems as well.
I really think it's we as adult society that needs to do a better job of respectfully listening and respectfully learning how to share power, how to provide ways that we can invite young people's ideas and energy, because we desperately are needing that idealism to, in a sense, help counter many of those vested interests that exist virtually in every government in every country of the world.
When it comes to mental health challenges, it is a huge moment in life that can determine so many things. It is a key moment when we define our identities, when we define our futures.
The prevalence rate of depression in adolescents is increasing very fast because of various reasons. I think social media can be a double-edged sword. They can enhance the stereotype of mental health issues, but they also can help people to combat stigma and discriminations. I'm very happy that nowadays we are not that afraid of sharing mental health concerns for ourselves, for our children. Talking is a nice start, but there are so many other services need to catch up. But how to help the children? Well, I think we need more evidences, more research, more data.
While mental health problems are common during adolescence, not all of them persist into adulthood, particularly if the episodes are brief. Prevention and early intervention are critically important.
We desperately are needing to do better in terms of the quality of mental health services that are available to young people. There need to be more services in every country of the world. They need to be better targeted. They need to be of higher quality. We need to be taking that step back, in a sense, to ask ourselves, in what ways are we as adults creating pathways for young people to truly feel welcomed, that they belong, and that they have a meaningful future?
Children are not just little adults. There's a lot of physiological differences as well, or problem. It's not very easy to recruit children into clinical trials. And you can imagine why, because we do not want children to be at great risk with a new medicine. We protect children from research, but in real life they will be exposed to these drugs, and then we don't know which dose to give. But how do we find out which dose to give? So we should protect children through research and not from research. To potentially make it easier to do clinical trials in children is to have the aid of computer models. Using these models could reduce the number of patients in your trial, but also the number of blood samples to be taken. We still need more information to put into that model. I don't think we will never have to do research in children.
Comprehensive scientific research into the most common childhood cancer has led to survival rates increasing from 5% in 1980 to 90% today. But in low and middle income countries, the survival rate is only 50%.
So we have to consult with the children more than we have been doing up till now. They always say you're talking about us, but you're not talking with us. And I think it's very rewarding, especially you want to inform patients about a trial, and then you've got this information leaflet nobody reads or understands. Together with the young people, we have developed a little cartoon for one trial to explain why we're doing the research.
Scientists want to make sure that the amount of medicine that people are taking is enough. But to find this out, they need help from people like you.
And I really liked that film. The input of the young people was quite interesting. It's amazing how you can really explain it in such an easy, accessible way.
And this information helps doctors to give exactly the right medicine to people all around the world.
Every young person learns most effectively not by being told what their parents or being told by doctors what to do, but rather learning by doing it. It's the bedrock of consultations with young people, whereby rather than just simply the doctor engaging with the parent is really trying to orientate those consultations much more directly to the young person themselves for part of a consultation, ideally without the parent in the room. Because when it's the young patient without the protective parent there, then they're forced to talk, they're forced to learn, they're forced to be able to gain that experience. And certainly young people become much more articulate when given those opportunities. So learning by doing is at the bedrock of consultations, but it's increasingly at the bedrock of the notion of co-design with research, of co-production of research with young people as well. And this whole movement towards ensuring young people's participation within a research agenda right from the very start.
Medical advances don't benefit children in low and middle income countries to the same extent. Globally, 1 in 4 babies are born too soon or too small, accounting for more than half of all deaths in the first 28 days of life. The burden is highest in South Asia, Sub-Saharan Africa, and in humanitarian contexts. Every newborn child and adolescent has the right to survive and thrive. They matter now and must be included in universal health coverage.
There's the largest cohort of young people ever. It's 1.8 billion young people between the ages of 10 to 24 that are existing right now in the planet. Adolescents were the missing population in universal health coverage. And there is this myth that adolescents, because they are young, they are strong, and then they are healthy, and that they are not a population that you should focus too much when it comes to protect them. But in the end, they are living a key moment in their development that can really be a deal breaker for so many aspects of education, labor, their families, when it comes to unwanted pregnancy, when it comes to not having an STI that can live with them for the rest of their lives or can even end their lives sooner. Accessing education about sexuality, about reproductive health, about identity, mental health challenges. It is a huge moment in life that can determine so many things. And I think that when we take a rights-based approach, we are really failing a huge population that has the right to live their life as they would like to live. We as young people should matter because we exist, not because we are just a resource in the planet. It's a matter of human rights, I think, that at some point.
Universal health coverage requires accessible packages of care, matched to local need and acceptable to children and adolescents. Young people's voices and participation are crucial.
Yeah, it's interesting when many people think about when does adolescence end, they often think that adolescence ends at 18. Thinking about the age of 18 is just so overly simplistic when we know the complexity of about what's happening in these ages. Personally, I think we need to be much more nuanced in relationship to our understanding of adolescence. And we need to be thinking about balancing participation and engagement on one hand with what we do for much younger children as well, where we care and protect. And so I think very much that around those activities that are safe, we need to be absolutely thinking about lowering the age below 18. And I commonly think of the voting age, for example. Scotland is a really good example where they lowered the voting age from 18 to 16. That cohort from 2014, who were the first to be enfranchised at the age of 16 and 17 at the referendum, when they've studied their voting practices over the subsequent 7 years, remained much more likely to be civically engaged and vote than the 18 and 19-year-olds who got the vote at that age. Whereas around some other activities that are less safe, such as driving, for example, we may want to think about a more graduated ageing. Driving in Australia is a really good example of that. Motor vehicle accidents and injuries are one of the greatest causes of death in young people.
And as adult society really understand the modern world that young people are experiencing? Are we doing everything we can to understand what they are going through?
And that requires us to become more humble, requires us to become better listeners, and requires us to be able to put in place the sorts of structures and mechanisms and processes by which young people can truly have a seat at the table that isn't simply tokenistic.
Our governments and policy makers are not fully aware of how technology works in these advanced ways, and clearly regulation has not kept pace. And if there is this disconnect between policy makers and what young people are experiencing, the policies will not be responsive to our demands. So it's extremely crucial that policymakers and adults try to understand the way in which we as young people are experiencing the world. We feel that the honesty that young people bring to this conversation is an example of how young people are willing to challenge traditional systems and try to rethink a world where things can work differently. Our healthcare systems can be redesigned, our education, social support systems can be redesigned to meet our evolving needs, because things can't stay the same. A better future would be one where the cost of inaction doesn't have to be borne by an adolescent who has to give up on their dreams for a better livelihood, give up on their dreams for a safer or healthier future. A vision of a better future is one where adolescents have the agency to shape health and climate policies to address the needs that concern us the most today and will also protect future generations.
In this, our 200th year, we draw attention to child and adolescent health as a critical health issue. To drive progress, we have two asks.